Great. Good afternoon, Dr. Sarkar, Ms. Debashree Mukherjee, Dr. Jonathan Demenge, Mr. Hugh Varagan, Dr. Magdalena Urbaniak, Dr. Godanta Naman, Ms. Sakshi Chandra Dasgupta, Dr. Paromita Chakraborty, Ms. Mary Abraham, colleagues from various institutions and distinguished participants. I welcome you to the 2021 edition of the Energy and Resources Institute's annual flagship event, the World Sustainable Development Summit, being held virtually under the broad theme, Redefining Our Common Future, Safe and Secure Environment for All, from 10th to 12th February 2021. This edition of the WSDS marks 20 years of the platform, and it is a matter of great pride for all of us at TERI that all of you, speakers and delegates, have been able to join us for this very important milestone edition. Your support is instrumental in the success of the platform and our efforts. With this, I'm delighted to welcome you all to the thematic track event titled Monitoring of Community Wastewater for Early Signaling the Spread of COVID-19 in Chennai City. This study is supported by the Swiss Agency for Development and Cooperation, SDC, and conducted by a consortium of scientists, academicians, and policy scientists from SRM Institute of Science and Technology, TERI, and Mugama Consultants Private Limited. I, Girija Bharat, am the director of Mugama Consultants Private Limited. Just a brief profile about me. Prior to this, I have been with TERI for many years. Also worked with USAID, been with World Bank, Council of Scientific and Industrial Research. I'm part of the drafting committee of National Policy of India on safe reuse of treated wastewater for Ministry of Jal Shakti, which is supported by GIZ under the India-EU Water Partnership. I'm delighted to be part of this project, right from conception to implementation and then culmination of the event. Thank you for being here today. It gives me great pleasure to invite Dr. Sarkar, Dr. S K Sarkar, to welcome the panelists and participants today and introduce the study on wastewater monitoring. Brief about Dr. Sarkar. He is a senior director and distinguished fellow at TERI. As an IAS officer of 1979 batch, he has served the government of India in several key positions, such as Secretary of Ministry of Water Resources, Department of Personnel and Training, as well as Member Secretary of West Bengal Pollution Control Board. He has been actively involved in formulation and implementation of policies on various facets of environment and water resources. Dr. Sarkar has done his master's and PhD from State University of New York, Stony Brook, USA. We are privileged to have had his guidance in this study. Over to you, Dr. Sarkar. Thank you.
Good afternoon, Girija, and I welcome all of you, the distinguished participants and distinguished panel members, for this thematic session of the WSDS event. This thematic discussion is based on a study taken by TERI, SRM Institute of Science and Technology, and Gamma Consultants. This study aims to fill the gap in the estimation of total community disease spread in the absence of a larger coverage in testing of population by using non-invasive and economical alternatives. The main goal of the study is to develop an early signaling of a spread of COVID-19 in communities in Chennai during partial and lockdown period. The findings of the study has the potential to be replicated in other parts of India and is useful for the policymakers and public health practitioners by providing real-time scientific assessment of the spread of COVID-19. As you all know that the scientists and researchers across the world are working on a wastewater-based epidemiology approach, a new method to detect SARS-CoV-2 in the wastewater of communities and provide early warnings of resurgence. There are various advantages of wastewater surveillance. Wastewater-based epidemiology can help in the detection of SARS-CoV-2 RNA in human feces a few days to a week before symptoms appear. This is one of the cost-effective approaches for obtaining population-wide data as opposed to the cost involved in individually testing large number of patients. Moreover, one wastewater sample can provide data on the average infection rate of thousands of people, and the aggregated data can be useful for areas with low clinical testing rates. One of the output of this study we will be presenting in this event is the policy brief. The policy brief presents the results of the research and highlights the advantages of wastewater surveillance, especially in the context of developing country for addressing public health interventions during pandemic. It highlights the results of the research study that strengthens the available literature on wastewater surveillance as an important tool in complementing existing COVID-19 surveillance systems. It also points to wastewater surveillance as an inexpensive source of real-time mass data collection for indicating infection trends within communities, information on emerging trends of infection, etc. With the wastewater surveillance data, while the wastewater surveillance data, when analyzed effectively, provides real vital information on diseases, it has to be noted that in India, about 70% of wastewater is discharged untreated into water bodies and in the open. The monitoring should also cover the vast majority of rural areas and suburban urban areas that do not have access to centralized sewerage systems, and wastewater samples can be obtained from sewer system manholes to find the sources of the virus, and a robust monitoring system be devised. Wastewater-based epidemiology under the COVID-19 pandemic can also aid in reducing impacts of the pandemic that are hindering in the progress of sustainable development goals. Operationalizing technology, resources, directing appropriate legally binding policies for wastewater surveillance can support a large database of health information required for effective public health action. With these few words, I once again welcome all of you for this event of DSDS. Thank you very much.
Thank you, sir, for the insights. May I now invite Ms. Debashree Mukherjee, Additional Secretary, Ministry of Jal Shakti, Government of India. Ms. Mukherjee needs no introduction. In 1991 batch IS officer, she has held several important positions, including CEO of Jal Board, Delhi Jal Board, Joint Secretary at the Prime Minister's Office, and Chairperson and Managing Director of Delhi Transport Corporation prior to joining Ministry of Jal Shakti. She was also the urban advisor to DFID. Ms. Mukherjee is an alumni of Loughborough University, England, and JNU, Delhi. Over to you, Ms. Debashree Mukherjee. Thank you.
Dr. Sarkar, Girija, thank you very much for those kind words. And it is a great privilege for me to be here at this meeting of the Sustainable Development Summit, particularly in this area of monitoring sewage as an early warning system to detect the spread of COVID-19. I think at this point of time, there cannot be a more timely, more appropriate intervention in terms of scholarship and policy. I am aware that monitoring of sewerage has worked in terms of the detection of the polio virus. And there is a lot of work happening across the world to, sorry, am I audible?
Yes, you are.
Okay. So there's a lot of work happening across the world on looking at the spread of the COVID-19 virus, detecting the COVID-19 virus in wastewater. Now, I had the privilege also, but initially I had the privilege of being part of the empowered group that was working to push testing, increase testing to detect the spread of COVID. And at this point, also, I'm working with the empowered group, which is looking at facilities, spread, the kind of infrastructure that you need, looking at the direction that the disease is likely to take or is taking. Now, so therefore, I know at first hand how we have been grappling with changing science and changing knowledge in terms of tackling this disease. And therefore, whatever new tools, whatever systems that can be made available to actually detect the disease is very, very welcome in terms of being able to respond. Of course, I think members who are present here must also be fairly well aware that the recent serosurveillance study that ICMR has completed has demonstrated that seroprevalence across India is in the range of 21% all India. In urban areas, we are looking at 26%, 31%. And in cities, serosurveillance studies and seroprevalence data across cities have actually shown much higher levels of antibodies in the community. Now, obviously, that indicates a very large number of asymptomatic infections that we cannot capture through the testing process. And therefore, this is a particular challenge in terms of being able to detect and monitor the spread of the disease, particularly in the context of variants that are being reported across the world. So therefore, I think this study is much welcome. I think it is timely, appropriate, and I for one, am really looking forward to the policy brief presentation that is supposed to follow. I also understand that this study has focused on Chennai city, urban areas, so this is a start. Given the way the disease is now, that we think that the disease is now moving, it would be necessary, and Dr. Sarkar said it, so I'm just sort of repeating for emphasis. It would also be important to look at and set up protocols for rural areas, for unsewered areas. Where do we collect samples from? How do we interpret those samples? What are the testing mechanisms? What kind of, how do we sort of, move from the community to a set of households? Can we make it more specific to try and identify the disease and the, the severity of the disease? I also expect, and I think this is another, that these tools that we create, the protocols that we create, will also be important in terms of looking at other diseases. And so this is something that this is an emerging area, and I think we really need to put focus on this area. I will stop here because I really look forward to the policy brief, and I hope to learn from this discussion so that we can take this back and carry this effort that has been done to scale. Thank you very much.
Thank you so much. Those were very valuable insights. In fact, for us, we have thought through right from the beginning. SDC has mentioned that if the research is going on, there has to be some output which should come in the form of a policy bulletin or policy brief, which basically can translate into action. So here we are with our policy brief. So may I request you to kindly launch the policy brief titled Detecting SARS-CoV-2 in Wastewater an early warning signal for COVID-19, which is jointly authored by Dr. Paromita Chakraborty, Ms. Avanti Roy Basu, Ms. Mary Abraham, and me, Girija Bharat, under the guidance of Dr. S K Sarkar.
Thank you. I consider it my privilege.
Thank you so much. Thank you so much. This was nicely presented. I also thought it pertinent to bring up here that we had launched a policy bulletin related to the project in December 2020, which has covered several aspects of this research study. We have also submitted scientific articles to peer-reviewed journals for publication and wider dissemination of the study. We will be sharing these knowledge products with the participants, the speakers, and all other relevant stakeholders. Now let us move to the technical session. I would request the participants to put question and answer in box and mention the name of the panelist to whom it is addressed. Now, may I invite Dr. Sarkar to chair the technical session and invite Dr. Paromita Chakraborty to deliberate on the findings of the study. Briefly about Dr. Paromita Chakraborty. She is a globally recognized environment scientist. Her work on persistent organic pollutants, endocrine disrupting chemicals, heavy metals in water, soil, and air has been internationally recognized, and she has been invited to speak at the Stockholm World Water Week and other national and international platforms. She has received several awards, including the He or She Award for Environment Science and Aqua Excellence Award 2020. Over to you, Paromita. Thank you so much.
Thank you, Dr. Girija. Good evening, everyone. I will be presenting the technical part of our project, Monitoring of Community Wastewater for Early Signaling the Spread of COVID-19 in Chennai City. This project was funded by Swiss Agency for Development and Cooperation. And we, the major leader for the projects, I was taking care of the technical part where the policy part and the water and sanitation part was taken care by Dr. Sarkar and also by Dr. Girija Bharat. Dr. Sarkar is a former secretary, Ministry of Water Resources, member secretary, West Bengal Pollution Control Board. And Dr. Girija Bharat is the director of Miyugama Consultants. So we were a team to initiate this project, and I was leading the technical part, so I will directly come to the technical session. So my outline of my talk would include exactly what was the question, like how would we be collecting the samples? How would we design the sampling plan? How would we extract the RNA from the wastewater samples? And then how can we analyze it? And what are the results that we are getting out of this kind of new set of experimental techniques that we have conducted, and a short summary on this. Now, the first paper that came published by Ahmed et al., like it was a study in Australia, which has talked about like the first surveillance of wastewater, especially for SARS-CoV-2. And with this surveillance, like it was easy to understand that wastewater can be a very good technique to monitor the spread of SARS-CoV-2 within a catchment. As simple, like the wastewater will be taken and then the wastewater has to be concentrated and the RNA extracted would be run by reverse transcriptase polymerase chain reaction. Now, what would we target in the wastewater? Wastewater, like when we talk about SARS-CoV-2, the important part is this nucleocapsid. This nucleocapsid has two important components, this N1 and N2 nucleocapsid protein. These are the two which we have targeted, and most of the studies in wastewater surveillance which has targeted to understand these are typical specific for SARS-CoV-2. So the primer and probes were designed specific to N1 and N2. With this background, like we could see a lot of papers after this came out which talked about the wastewater surveillance, and including the first one from IIT Gandhinagar by Dr. Manish Kumar, who came up with the paper about the STP in Ahmedabad. And then the wastewater samples from hospitals in Rajasthan that also came up from India, and in foreign countries like in Europe, in US, in Australia, like which was the first one. So there were several papers talking about this technique as very, very important and a cost-effective one to understand the spread of SARS-CoV-2 during the pandemic period. So this led to very important research questions, which many of us, including Dr. Magdalena, Dr. Girija, like we have worked out a very important paper, which is talking about like along a riverine belt, like there would be a need to do this kind of surveillance, typically for the wastewater treatment plants, which can actually tap the particular population catchment, and we can understand how much of the virus can enter in the system. And being a country impacted by monsoons, it is very, very essential to understand like whether the surface runoff of the raw sewage or, you know, like during the monsoonal phase, whether the sewage can come down and also be spread along the riverine catchment. That would be another interesting story which we felt can be added upon apart from only looking into the wastewater treatment plants. And also, there are certain sectors like which are not so well, the socioeconomic condition in those areas may not be as good as in the urban centers. In those cases, those low sanitation condition might have another story to understand during this pandemic period. So these were the novel research questions that we had in our mind when we started this research. So what was the goal for us? We took Chennai city as a model city where we have checked the early signaling. We wanted to measure SARS-CoV-2. We wanted to map the loading along the riverine belt and also in the STP, sewage treatment plants, the pumping stations. And we wanted to detect constantly at a different time interval in SRM hospital wastewater as well, which is actually in a peri-urban area. And in addition to this, we also wanted to see, that was a very, very important thing, that whether there is a co-occurrence of some organic molecule which can act as a marker along with the SARS-CoV-2. That was an important question we wanted to answer with this project. So why we chose Chennai city? Definitely the first wastewater surveillance that was reported was by Metro Water from Chennai city. And there was a sudden outbreak in the city, especially in the northern parts, like where the numbers were really high. And it was one of the hotspot that India had during this early pandemic period. And the rivers in the city are very stagnant. They were direct sewer outlets. So that was also another important factor that gave us this signal that we also need to understand whether there is any marker which can track that human waste are coming along the river. And with this human waste, we can also track the spread of SARS-CoV-2, not in terms of like, because it's not defined population catchment, but still we can get an idea like what is actually happening within the community. So we have already seen that caffeine acts as a very potential marker in order to understand the human waste that is released to riverine belt. So it was important to use such markers to understand the story better. So how did we collect the samples? Before we collected, important part is we have to take permission from the Indian Council of Medical Research, WHO. Methods has to be followed. So it was a big opportunity for us because we could get guidance and support from Chennai Metropolitan Water Supply and Sewerage Board, and they approved our work, and jointly we worked it out, especially for the design and the sampling campaigns. There was a huge support from Chennai Metro Water. So the samples were collected from 4 sewage treatment plants, 5 sewage pumping stations, and SRM hospital wastewater. We collected the samples, and I should mention that we didn't waste time. We extracted the samples the same day. We were working day in, day out, and we did the analysis immediately after the same day that we have collected the samples and maintained all the protocols that was required so that there is no discrepancy in the data set. In the riverine belt, also we collected along the 2 rivers, Chennai city. This is the map for Chennai city, the Kuam and the Adair river, and you can look at the STPs, the sewage treatment plants here, and the plus sign is for the sewage pumping stations. So for the sewage treatment plants and sewage pumping stations, we have collected lockdown samples. This was the first study that was done during the partial lockdown and after the lockdown. And after the lockdown, we have taken care of all the STPs and sewage pumping station, wherein for the rivers, we had collected samples during partial lockdown and also after lockdown. Similarly, we had a site in SRM hospital wastewater treatment plant. We took hospital wastewater, direct hospital wastewater at different time intervals during the partial and the post-lockdown phases. For the STP, we collected samples from the influent, from the primary sludge, and also from the outlets. What we did is we have developed 4 different methods. Supernatant method is well established method. We have also come up with composite method, sediment method, and syringe filter method. And for each of this method, we have run in duplicates, and each of this method we have taken care of analyzing, detecting N1 and N2 gene that is typical of SARS-CoV-2 and RP gene that is present in any living organism. So that was a control. So altogether, we have analyzed over 1,500 samples during this project period. Now the supernatant method, it takes a little more time. It takes about 18 to 22 hours. And in this, we take the samples, 250 ml of the samples, which is centrifuged. And then the supernatant is taken, which is further centrifuged. And then we filter the sample, and it looks like this. And you can see the cloud-like phases here after you have filtered it out. So we take this, and then we finally use Amican ultracentrifugal filter, concentrate the sample. So we are basically concentrating the wastewater and taking the RNA for RNA, and take the RNA, go for the RNA extraction procedure. There are other methods which run for 1 to 2 hours, which is composite method, sediment method, and syringe filter method. Composite methods is pretty much an easy one, just 1 ml of sample is taken in a centrifuge tube like this, and then we add 10 ml of proteinase K, and then we do the place it in dry bath for 10 minutes for RNA extraction. But in the sediment method, this is one interesting one, where we're taking the sample and centrifuge it. After that, 1 loop of sediment is kept into 1 ml of PBS buffer, phosphate buffer saline solution, and then 1.5 ml centrifugation tube. So again, then it is subjected to RNA extraction. This is important because we have very interesting results with this method, especially for the STP samples. Syringe filter is that we are not wasting any time. Immediately, we are just using syringe filter to take the samples, and then 10 ml of samples, and then finally going for RNA extraction. After this RNA extractions, we have used a nanodrop to and figured out a procedure to estimate or enumerate the number of RNA copies that we got in each sample. It is a semi-quantitative method. What are the results we saw? First of all, the CT values, the cycle threshold values, the result comes like this. The signals are like this, and then you have the relative fluorescence, which is in your y-axis, and the x-axis will have the cycle threshold. The lesser the cycle threshold, it is said like the more viral count can be expected. And we did this with all the 4 methods. Interestingly, for the STP inlets, all the inlets showed positive results with all the 4 methods. That was an important point, although the RNA copies were differing depending on the method based on how much quantity has been extracted. Now, if we compare all the extracting techniques for STPs, typically, we found that that SED method was actually much more, apt. Like we were getting some interesting results, and there was not a single sample where SED method didn't work for STPs. We are suspecting a factor that there is a possibility that the virus is hydrophobic in nature, and they have a tendency to more partition onto solid phase, which could be a reason for seeing this factor. In SRM hospital wastewater, this is again interesting. The SUP method, the supernatant method, was much more important because the dissolved solid, which was much higher, or the suspended solid, which was much higher in STPs, but comparatively the hospital wastewater, it wasn't that high. And supernatant method worked very well for that. So this is like we suggest, like where the suspended solid would be more, we should go ahead with SED method along with the supernatant method. Now, in this method, what we found was like the days when there were certain dates where the number of RNA copies were much higher. This we are suspecting with the number of patients being admitted who are actually affected by SARS-CoV-2, and because the hospital wastewater was giving this kind of signal for SARS-CoV-2 in those dates. This is during the partial lockdown phase. Now, this is an interesting data that which shows the spatial distribution of the viral load in the riverine belt, which is in figure A, and figure B shows the chemical markers, the traces that we have used. One important thing, which I missed telling while discussing the STP front, we also seen that the SARS-CoV-2 was not at all seen in the outlets. At the same time, the markers, especially caffeine, which can be used as a very potential marker for human waste coming into the stream, in the wastewater stream, we could see a drastic 80 to 85% reduction in this marker in the outlets, which talks about the proper functional efficacy of the STPs in Chennai city. But again, then this figure shows like during the lockdown, partial lockdown phase in the riverine belt, the RNA loading, the copies were much lesser compared to what we were seeing in the post-lockdown phase. Especially this is an area along the Coam River where the canals are joining. Here we found not only the high loads of the viral load, but also high loading of the chemical markers. That was one important point that we saw in the riverine belt. So as I was telling, we tracked a lot of organic traces, which was categorized under personal care and pharmaceutical products. We have seen that caffeine concentration from inlet to outlet, there is a drastic reduction in each of the sewage treatment plants, like over 85% was removed, which means then this is a treated water, was much more clean, and it didn't show any viral loading in the treated water, which means that the STPs are functioning perfectly well in Chennai city.
Paromita,
in addition to this,
we need to be a little faster. Maybe in next 1.5 minutes, please.
And we have seen that organic traces, we could see concurrence of a lot of this organic traces, especially for the SED method. And this concurrence, which was like more than 70%, it is in bold, and we are seeing this SED method worked very well. And caffeine definitely is an important marker in this regard. When we see the SED method, these are the 4 methods with which the real-time infection, which is given in this green color, like the predicted infection, and the real-time cases are given in this brownish color. So we see that with the SED method and the supernatant method, it was pretty much close to what we saw. The predicted infection as well as the real number of cases were much similar compared to the other two methods, which are composite or syringe filtration. So SED and this supernatant method were pretty much following the track that was given in the real-time cases. So in summary, we can say that we have established a laboratory where we have come up with the level 2 biosafety cabinet with this project, and we found that STP inlets were showing high loading wherein outlets were not. And this also was combined, it was in tandem with the reduction of caffeine, which was a very useful marker to understand. And not only that, we have seen that there is high quantity of azithromycin, not only in the STPs, but also in the surface water, which possibly associated with the use of azithrol during this pandemic phase. And after the lockdown also, we are seeing high quantity of viral loading. So with this, I would say that the striking feature of this project is a cost-effective, real-time technique to understand the spread in a catchment, and policymakers definitely can take a lot of action. I have to thank Metro Water once again and their people who had been helping us in the project, and also my team of scholars, young scholars, Mr. Sarath, Mr. Ronnie Rex, who had been working with me in the field, and they had been really great support in the riverine phase. Mr. Nihal Mohammed, who was a research assistant in the project, and Dr. Sundar, who was a postdoc in the project, and Mrs. Monitoring Mukherjee is another research scholar in my group. So she was an added help, and she had been coordinating a lot of stuffs in the project, in the lab and outside. So all these people were really, really contributing a lot to make this project happen in a successful way. And thanks to SRM for the proper management of the biomedical waste. That was very important for us to take those permission. That was very, very essential. So with this, I think I took half a minute extra. Thank you. And if you have any questions, or please contact me. My email ID is there. Thank you.
Thank you. Thank you, Paromita. That was very, very insightful. And I take this opportunity to also invite Dr. Jonathan Demenge here. Our next speaker is Dr. Godantaraman. May I request him to give his presentation? A brief profile about Dr. Godantaraman is director, UGC Human Resource Development Center, and is as well as head Center for Environment Sciences, adjunct faculty Center for Ocean and Coastal Studies at University of Madras, Chennai. He's a visiting fellow at the Department of Marine Sciences, University of Calcutta, and was a recipient of JSPS postdoctoral researcher at Hiroshima University, Japan. Over to you, Dr. Godantaraman. Thank you.
Good evening to each one of you. First, let me thank the organizers and Dr. Chakraborty for inviting me to take part in this summit. Let me talk about how this COVID-19 virus is passing through the environment and what kind of impacts on having it. Please, in the next slide. As all we know that almost be past 1 year when the World Health Organization declared COVID-19 is a global pandemic, even though it was spread in China in December. After that, it was almost infected more than lakh people and almost 250 countries affected throughout the world. So I don't want to explain the structure of this COVID-19 virus. It is a severe acute respiratory syndrome coronavirus, SARS-CoV-2. And already Madam has explained the structure of this particular virus, how it is acting and how it has thing. The next one, please. Next slide, please. Before going into that, infectious diseases are still challenging in the last few decades. After the outbreaks of SARS in China 2002, Ebola in West Africa, and MERS Middle East Respiratory Syndrome in 2015, The beginning of 2020 was marked as a novel coronavirus 19 outbreak by World Health Organization. The severe acute respiratory syndrome coronavirus that causes COVID-19 seems to be spreading mainly from person to person, easily and sustainably, leading to the respiratory illness and death of old people and also suffering, delaying and medical conditions. Because of the absence of specific vaccines or treatment method for eradicate for control the COVID-19 pandemic, the entire world has chosen the only option, a lockdown strategy to stop the spread and to protect their populations from this COVID-19 pandemic. Next, please. Next slide, please. This is a recent data showed that how this virus is spread, and almost we have in India we are giving more than 10.8 million people affected, and we have also recorded 10.5 million recovered from the illness, and more than 150,000 people are dead. So this trend is going almost now, but in India now we are able to control this pandemic, and we almost many of the districts and cities, the number is coming down very drastically. So next slide, please. The way of which how these 19 pandemic viruses are passing, there are three ways. One, contact routes, mainly through the droplet transmission when a person in close contact with someone who has respiratory symptoms, that is cough and sneezing. And particularly this is happen in the closed environment where the houses or the rooms where we have contact, then it is very easy to pass this. The risk of having his or his noses, mouth or nose are they exposed to potentially ineffective droplets. The second one, transmission through vomits, the immediate environment around the infected person and direct contact with infected people and indirect contact with the surface in the immediate environment or the object whichever used by the infected person. So it is easily passed on to the person who is not affected through them. The airborne transmission also possible through the endocrine intubation and suctioning all other. Also, it is passing to other persons. Next one, please. So how long these viruses can survive in the system? There is a report that it persists only 2 days in hospital wastewater. That all Dr. Chakraborty has explained how this wastewater and the phases and how it is spreading and to this environment, and how these other environmental factors, particularly the sun, temperature and pH, humidity are all affecting. So I'm going to the next slide because this already explained by Dr. Vinda. This is the effect of transmission through the biocell, how it is passing to the human being and based on this. So that also I am not going to talk about more on detail on this. The next one, how this viability of the SARS virus 1 and 2 in various surfaces, it depending upon the environment where it is in. The longer viability of both viruses for on stainless steel and plastic. The estimated median half of SARS virus 2 was approximately 5 to 6 hours in stainless steel and 6 to 8 hours in plastics. So it depending upon the platform, it is must vary. So there are the ways how these can be spread there for water. But so far there is no research has been done on whether these viruses passing through the water body, and still it is a question mark, and research should be carried out also. The wastewater has already, the study has started, and more than 40 countries have already working out and published research article and identified this wastewater research is useful to identify can be used as a tool for the identification of this particular virus load and things. The temperature is also very sensitive to heat these viruses, and it is, for example, at temperature 70 degree or higher, the virus will survive for 5 minutes or less. At 4 degrees Celsius, the virus is stable and is able to persist for weeks with little reduction. That is why the tropical countries like India, the death rate as well as the affected rates are coming down compared to Europe and other countries where they have the temperature less and it is cooling conditions. The pH also is a very important factor, and that also playing between 3 to 10, the fluctuations, many pathogens are able to sensitive and larger fluctuations. And the humidity. Humidity solves service longer at lower relatively humidity, and the effect of humidity on virus survival may also depend on the temperature. So the sunlight exposure, as I told you, temperature is playing a vital role, and that is can control or the dispersion of this bacteria can be reduced, the good number. Next, please. Wastewater. As Dr. Chakraborty is telling, environmental surveillance by testing wastewater for evidence of pathogens has a long history. The research has been done in 19s of use of public health, particularly poliovirus, and more recently antimicrobial resistance. They have scientists has conducted for use of poliovirus and the antimicrobial resistance by using wastewater. Now we are trying to use this kind of study for the COVID-19 also. Wastewater, which also included household and building, as well as non-household sources from industrial and rainwater. Wastewater can be tested for RNA, that SARS-2 and the virus that causes COVID-19. That all has been done by the Dr. Chakraborty team, and they have come out with a very good result of the baseline data, which is definitely going to be useful for other scientists to carry out such a result in other areas also. Researchers around the world, over 40 states, have initiated programs to collect wastewater samples for COVID research to determine the presence of infected individuals or to estimate the extent of community spread. Detection of non-infective RA fragments of SARS-2 in untreated water or sludge has been reported in a number of research studies conducted in multiple locations at Italy, Spain, Australia, Middle East countries, and United America and France. Researchers in the Netherlands, France, and United States, America demonstrated a correlation between wastewater SARS-2 RNA concentration and COVID-19 clinical case. There was a comparison they have done, and they find that there was a correlation between the wastewater and the clinical case reports of COVID-19 pandemic. Next, please. How we can control these? These are all some of the ways. Almost we are now using it for the Googles and face shield, medical cap and shoes, mask. So all the things now we are forced to use whenever we go out, or even in the sitting in the office or in the home. We have to take precautionary to maintain the social distancing and using of this mask and all other thing to avoid to get to that infected COVID-19 virus. So how the disposal of these materials? We have the category of yellow, red, and white and blue. So accordingly, we have to try to divide the separate the waste. For example, human anatomical waste, animal anatomical waste, solid waste, expressed to discard medicines. All we can put it in the yellow bag, and the red carpet contaminated waste, recycling bottles and urine bags, all we can use it in the red. So like that, we have to separate the waste coming from the COVID-19 patients or in the medical or in the households, so that it is easy to make a remediation process and treatment for all the things. Next one, please. So there are some research questions how we can carry out this. Is there any relationship between air pollution, particularly associated with the particulate matter 2.5 and particulate matter 10, and COVID spread in urban, suburban, and rural transit in Indian real-time experimental design? So that's what we are now talking about, how we can carry out the research, particularly with reference to the air pollution, where the particulate matter are very concentrated, but fortunately, due to this coronavirus, now the industrial pollution and the air pollution is getting drastically. And also how we can study the role of temperature or absolute humidity on what kind of effect having on this spread of COVID-19 diseases. The direct discharge of points and release of untreated waters, that already the study started, and we can conduct more research in particularly in the rural and in the other areas where we have more cases and more infected people. Thing. Next one, please. Finally, environmental surveillance research should be seen as an important public health objective to advance knowledge about COVID-19. So we have to encourage, we have to motivate the scientists to work on environmental surveillance by studying the wastewater and other materials. Much more research is needed to understand how SARS-CoV-2 detected in wastewater correspondent to COVID-19 transmission. Particularly, we have to compare the results what we have collected from the wastewater research and the clinical trial, so that we can understand the system, and it will also act as a early warning system of this COVID-19. This research should consider such variables as diverse dimensions, dynamic, diverse geographic areas, and different solid collections process at wastewater treatment facilities. So this study has to be conducted in different geographic locations, different places where the people affected the things, so that we can get a baseline data, as well as to get a clear picture how these viruses spreading, how these things are going well. It is also important to compare influent and sludge from the same wastewater treatment plant to determine which approach is more sensitive to low cost numbers in a population. So we have to find out a very good methodology to study these wastewater treatment for particularly these COVID-19 things. So what kind of policy recommendation when we can take it from this? This study has the potential of high reliability in urban settings in India for increasing the coverage of wastewater monitoring and surveillance towards 19. Being a cost-effective method for the early signaling of COVID-19, it could contribute to reducing the resource burden of clinical analysis in India. The study should provide inputs for scientifically informed decisions to implement public health intervention strategies consistent with legal and ethical considerations. So these can be taken while framing the policies for conducting study or for doing research on these wastewater surveillance by for surveillance of the COVID-19. So that has to be taken care when we frame the policy. Finally, I would like to link this COVID-19 pandemic with the UN Sustainable Development Goals. Interestingly, COVID-19 would accidentally contribute to the progress towards meeting several Sustainable Development Goals, United Nations SDG 1530. In particular of SDG 2 goal, end hunger, and SDG 12, ensure sustainable consumption and production rates in patterns, including the target to have per capita food waste at consumer level by 2030. So this way, the COVID-19 also helped us to achieve some of these sustainable development goals, and also it provided for us to this pandemic period, we are able to live in a very healthy, because the air pollution and water pollutions are very less, and that is why we are able to do this kind of research. So I am very thankful to all of you and for taking and listening my lecture. Thank you.
Thank you so much for the enlightening presentation. I would now request Mr. Joep Verhagen, Global Water Lead, Global Center on Adaptation, Rotterdam, Netherlands. He's a globally recognized water and community development professional who brings 25 years of international experience with a deep commitment and passion to improve the lives of the poor. His strong result focus, strategic acumen, and ability to reach beyond boundaries have resulted in an outstanding track record in addressing large-scale, complex development challenges in Asia and Africa. As World Bank Task Team leader and member of IRC, International Water and Sanitation Center Leadership Team, he demonstrated a high proficiency in the operational management of large-scale operational and technical advisory projects that were supported by high-level policy dialogues and innovative analytical frameworks. May I request Mr. Verhagen, the stage is yours now. Thank you.
Thank you very much, Girija. Thank you very much for taking the effort and time to listen. Also, thank you very much to the previous presenters. I'm presenting a slightly different perspective to the monitoring of COVID-19. I'm not a doctor. I'm a sanitation specialist, a water specialist, and I took a different angle at COVID-19 and the monitoring. Before I start, a small background on the place where I work, the Global Center on Adaptation. The Global Center on Adaptation was initiated by the Global Commission on Adaptation. The three people on the left-hand corner, Ban Ki-moon, Bill Gates, and Kristalina Georgieva were the people taking the initiative. The background was basically that when we talk about climate, we all talk about mitigation, trying to reduce the global warming. Talking about adaptation was almost seen as admitting defeat, right? I think as of now, we do realize the climate has changed, and no matter what we will do, it will continue to change for at least another decade, if and when we stop the emission of CO2. For that purpose, the Commission really decided to give a huge push to climate adaptation. COVID-19 is something we thought about, where we work on, because we see it as a kind of another global disaster, similar to climate change, though I'm afraid it's less impactful as climate change. When you look at the Netherlands, where I come from, where I sit, we've been monitoring, the Netherlands have been monitoring COVID-19 in wastewater. You see a graph on how the number of pathogens, viruses have been detected in wastewater. You see it going up and down. You also see on the right the infrastructure that we are using. As you see, it's modern, it's spacious. As an ordinary citizen of the Netherlands, I've seen really limited evidence of having a direct link between the decisions the government takes on how to deal with the pandemic and the number of the monitoring of wastewater. What our government is counting is the number of cases, it's the number of people in the intensive care units, and the number of people who, the number of fatalities. When I look at the Netherlands, I compare it to the rest of the world, you'll see that that the Netherlands is basically open defecation free. We have extensive and very fine granular sewer networks covering almost the entire country. I couldn't find a number, but I estimate around 99% of the country is connected to sewer. All the wastewater is being collected, treated in centralized wastewater treatment plants. And there is a very sophisticated wastewater monitoring system in place, supported by a very detailed regulatory framework. As I said, to me, it's not obvious that these data are being used to determine policies, to determine how the country best deals with the pandemic. If I compare this to the rest of the world, then there are around 4.5 billion people who do not have access to safely managed sanitation, what means where wastewater is being collected and treated. Most of these people are poor. There are about 3 billion people who are not connected to a sewage network. There are 3 billion people who are connected to a sewage network. Most of these people are better off, right? So it's the better off people who are connected to sewage networks. But even of all the wastewater being connected, that includes Europe, only part of the wastewater is being treated. So where that leaves us is that if you want to use a centralized sewage network to monitor COVID-19, you're likely to only capture part of the population and mostly the better off. What you see at the same time, it's the poor who are most likely to be affected by to be infected by COVID-19. They live in overcrowded, unsanitary conditions. 3.5 billion people lack basic hand washing facilities, what has been labeled as the kind of the first defense to COVID-19 infections. And for many people, it's the only defense they have. It's again the poor who are mostly do not have access to basic hand washing facilities. They rely on informal livelihoods. So working at home is not an option for the poor. I think many of us at the moment are working from home. I'm working at home, but I'm fortunate because I have space to work at home. I have a job that allows me to work at home. And I also have the infrastructure at home to do so. And if you look at kind of the vaccination, what we see is that the poor are the last ones who are likely to be vaccinated. So this is supporting the statement on the left. So what we see is basically it's the poor who are most likely to be infected by COVID, and that's what figures and numbers also support. At the same time, they're least likely to be detected having COVID, whether it's to direct monitoring, testing, COVID testing. But I think for me, from my perspective, this is also true for other methods like COVID monitoring to wastewater. Now, what it does, and I'm kind of taking things slightly forward, is that as per the World Bank, there are about at least 150 million additional people who will be living in extreme poverty due to the COVID crisis. So they're most likely to catch it. They're also most affected when they get it in terms of income, in terms of job opportunities. It's the poor who are most affected. What Kristina Georgieva mentioned is that we are actually deploying a huge and gigantic fiscal stimulus, and this is an opportunity, right? This is an opportunity for us, for all of us, to build back better and greener. Now, this is actually the estimate of how much money, funds, will be deployed as fiscal stimulus to deal with the COVID crisis. The number of zeros is staggering. It's actually $20.5 trillion are being mobilized to deal with the COVID crisis. And this includes also large amounts of money by the World Bank, ADB, AFDB, and other banks, and as well as sovereign governments. Now, the question is, what do we do with that money? And what we see is that in most cases, this money is being used to, as a first response, as an immediate response to economic downturn, as well as to deal with to support the health systems to deal with the COVID crisis. I think many of us, we should come together to actually ask the question, could we use at least part of these resources to build back better and greener, rather than really kind of plowing back the money into income support, health support the health systems, or to actually use this for the traditional infrastructure. For us, and that's why we kind of circle back to the COVID crisis, improving existing health, water and sanitation services is absolutely vital. It's vital for economic development. It's vital for human development. It's also vital to deal with future pandemics. Good and safe sanitation, good and reliable water supply is critical for the poor and all of us to deal with future pandemics and to deal with the COVID crisis. It also will improve sanitation systems, will also allow us to monitor more effectively for COVID and future pandemics. And what we said on the right, we think that investing this money in the right way will have a triple dividend. It will help us, it will reduce the pandemic risk, it will help economic recovery. It also will help us to be more resilient against climate change. Thank you very much for your attention. If there's any questions, I'll be very happy to answer them. Thank you.
Thank you, Joop. That was very, very insightful, and really appreciate your thoughts on building back greener and better. Very, very powerful thoughts, and really appreciate your linking with climate resilience, the triple dividend. Well, with that, let's move to the next panelist. May I invite Dr. Magdalena Urbaniak, Associate Professor, UNESCO Chair on Ecohydrology and Applied Ecology, University of Lodz, Poland, to share the international experience. She is an ecologist by education and with special emphasis on water resource protection. Her research has been focused on land-water transport of selected xenobiotics, including priority hazardous substances in the field of water policy and contaminants of emerging concern. The purpose of these studies is to optimize the bioremediation technique, reduce xenobiotics transport from the land ecosystem to water, and prevent its bioaccumulation in the ecosystems and biomagnification in trophic chains. This knowledge is based on the integrated water resource management approach and considers the river basin as the basic component of research performance. Over to you, Dr. Urbaniak. Thank you.
Good afternoon. Here is still morning, but good afternoon for all of you. Thank you for a very nice introduction of my research. I hope the presentation is visible. Sometimes I have problem with using Microsoft Teams, so please let me know whether you see everything. Do you see my screen, and do you see the title of the presentation?
Oh yes, we are able to see.
Okay. So let's get started. Dear colleagues, it is okay or not? Because I don't.
If you could put it on full screen, Magda.
It is full screen. It is full screen from my side.
All right.
You can see that? I see that you don't.
Magda, can you make it slideshow?
Yes, I'm doing that. I'm trying to do that, but somehow it doesn't. Like from my side, I can make the full screen, but apparently you do not see that. So that's the problem. I'm not sure how to solve that problem. Let me unshare the presentation and share again, okay?
This should do, I guess.
Okay, let's try again. One more. And right now, do you see everything? Do you see the full screen with the title of the presentation?
Yeah, I think.
Magda, it is not on full screen. It is like it's the.
Yeah, I see the problem, but I can't solve that. So maybe someone should share my presentation, because I sent it previously today morning. So maybe someone should share the presentation instead of me, and I will just present.
Mary, can you help Magda?
No, I think we can continue like this. We are able to see it. Even if it's not full screen, it's fine, I guess.
Okay. So let's try again.
Please carry on.
Okay, I hope you can see that that presentation. Please confirm.
Yes.
Okay. Dear colleagues, the immense global burden of infectious disease outbreaks and the need to establish prediction and prevention systems have been recognized as one of the serious problems, but also a serious challenge for human health. Despite multiple efforts, this infectious burden is still increasing. And for example, it has been reported that between 1.5 and 12 million people die each year from waterborne diseases. What's more, venereal diseases are listed within the top 15 leading causes of death worldwide. Rapid population growth, climate change, natural disasters, immigration, globalization, and also corresponding sanitation and waste management challenges are expected to intensify the problem of death in the years to come. What's more, most infectious disease outbreaks have been related to microbial agents, and in the vast majority of cases, the infectious agents have not been identified. However, it has been suggested that most outbreaks of unidentified etiology are caused by viruses. Viruses have been cited as potentially the most important and hazardous pathogens found in wastewater, and they are also included in the US EPA contaminant candidate list. Virus-related infectious outbreaks can cause uncontrollable negative effects, especially in dense urban areas and especially in developing countries where we cannot notice lack of sufficient sanitation systems and management of sewage. Traditional disease detection and management systems that based on the diagnostic analysis of clinical samples are not effective in that way. Those systems fail in early warnings of public health threats at a wide population level, and those systems fail also in prediction of outbreaks in a timely manner. That is why wastewater-based epidemiology has emerged recently as a suitable tool in monitoring of diseases spread and early warning systems. Wastewater-based epidemiology idea was first conceived by Platon in 2001, and these researchers hypothesized that the analysis of drug residues in wastewater could be linked back to population usage. Currently, wastewater-based epidemiology is regarded as an effective way to provide inexpensive, real-time and large-scale monitoring of community wastewater towards to understanding the infectious disease and resistance spread, antibiotic resistance spread, and to examine the emergence of new disease outbreaks at community level. The wastewater-based epidemiology has also been proposed as a suitable tool in monitoring of the COVID-19 outbreaks. In this case, monitoring of wastewater has become an indicator of the presence of the SARS-CoV-2 virus in the population, while being itself not a source of infection. The fragment of the virus, of the viral RNA in the wastewater has been reported by numerous research groups worldwide, and those reports show that wastewater-based epidemiology, that the approach of the wastewater-based epidemiology can give us an opportunity to reliably survey the presence of the virus in the population in a better and more harmonized way without direct testing of individual persons. It is also worth to underline that many studies detected the virus in wastewater before clinical cases were reported. So this indicates that wastewater-based epidemiology offers potential to form part of an early warning community public health surveillance system. Although wastewater-based cannot identify which individuals have been infected, it has several advantages compared to patient testing. For example, it enables us to detect the virus in human feces a few days to a week before the patient shows symptoms. This means that sewage surveillance can predict COVID-19 outbreaks even before individual patient testing and hospital admission. Additionally, one wastewater sample can provide data on the average infection rate of thousands of people, and this aggregated data can be especially informative in the regions with low clinical COVID-19 testing rates, so it means usually in developing countries. Additionally, instead of individually testing thousands of patients, collecting and testing a small number of wastewater samples is more cost efficient in order to obtain population-wide data. Additionally, continual monitoring of wastewater can be used to establish trends in current outbreaks, in identification of new outbreaks and prevalence of infections. Continuous monitoring of viruses in wastewater is also part of the proactive prevention approach in identifying potential outbreaks before they occur. And that approach includes early detection of the viruses in the population. The next step is early warning, solution developing and updating of technologies. And those again enable us to even more early detection of the viruses, even more early warning of the population, and so on and so on. Wastewater-based epidemiology has been also used as part of the EU strategy, European Union strategy to combat the COVID-19 pandemic. In July 2020, the European Commission has created a pan-European umbrella study to better understand the limitations and challenges of wastewater-based epidemiology. The aim of the umbrella study is to survey the presence of the virus in the population in a better and more harmonized way in order to predict the pandemic outbreaks. The program includes the development of a roadmap for systemic rollout of complementing ongoing national and regional surveillance in approach. Currently, the umbrella study involves 26 European countries. However, before the program has been launched, majority of EU countries have implemented the wastewater-based epidemiology approach to monitor the spread of the coronavirus in the early stages of the pandemic. It means in February and March and April. And for example, the earliest report of wastewater surveillance come from Netherlands, and that report was published just within a week after the first case of the COVID-19 in the country was confirmed. And since that time, many other reports have been published in order to show what is the dependence, the correlation between the concentration of the viral RNA and the outbreaks of pandemic. In Spain, for example, wastewater surveys were conducted from February to May 2020, and the virus was detected in 40 to 80% of samples. What's more, detection preceded the incidence of new COVID-19 cases in the population. Additionally, the authors showed that the viral RNA in wastewater matched the estimated cumulative number of clinical cases. In France, the monitoring of the presence of the SARS-CoV-2 virus in wastewater was conducted from March to April 2020, with very high frequency reaching 100% in the case of raw wastewater. Lockdown impacted the dynamics of the virus occurrence, and after the increasing phase, fewer loads reached a peak in early April and then started to decrease. This was concomitant with the reduction of the new COVID-19 cases that was attributed to the French lockdown. In the case of Italy, researchers investigated wastewater samples coming from Milan, Turin, and Bologna, and those samples were collected between September 2018 and February 2020. The authors evidenced that the virus was already circulating in northern Italy at the end of 2019, weeks before the first documented autochthonous case was confirmed. In Germany, 100% of samples showed detectable viral RNA. What's more, viral loads in wastewater were proportional to cumulative and acute number of COVID-19 cases in the catchment area. To conclude, the presence of the SARS-CoV-2 RNA in wastewater has been reported by many countries, and also has been presented today during this was presented during this at this conference by my press speakers. For example, Dr. Paromita presented excellent results coming from her project, ongoing project. Those information, those results adding some kind of information on viral circulation along the distinct pandemic phases, including pre- and post-lockdown assessments. Detections in wastewater were correlated with local COVID-19 incidents, preceding from 1 to 3 weeks the increase of new clinical cases in the population. What's more, the studies revealed a high rate of RNA detection in different matrices comprising of raw sewage, inlet and outlet wastewater, as showed Paromita, for example, sludge and polluted rivers. Some countries adopted the environmental surveillance as part of the routine COVID-19 surveillance, and that is the case, for example, of Netherlands, Australia, but also New Zealand. I would like to thank you for your time today. My presentation was pretty short in comparison to my first speakers, but after every presentation, I was deleting some slides because many topics have been already covered by my first speakers. That's why I decided that it's better to make the presentation more condensed and to not waste your precious time for something that you already have heard during this presentation, during this conference. Thank you once again for your time and for listening to my presentation.
Thank you, Magda. That was very interesting, and it's also very interesting to note that our research studies are quite aligned. You are also considering it as an early warning tool, signaling tool, and it's a low cost signaling tool basically for us also. And we are very excited to see that our studies are quite aligned.
So much. Thank you so much. Well, I'm not virologist, so I'm environmentalist, ecologist. So that is my main aspect. You know, how to predict the possible problems that can appear in the environment. So pandemic is one of those problems. So we have to fight with that, and we have to work together in fighting with pandemic. Thank you.
Absolutely. Thank you so much. With this, we come to the close of technical session. We have a few questions. Some of the questions I've answered, but then on some of the questions I would want the panel to answer before we go for the keynote address by Dr. Jonathan Demenge. So the first question is by Professor Bishwajit Paul. His question is, our country should strengthen our pollution control board and other regulatory bodies with state-of-the-art laboratories and sufficient competent manpower for inspection, audit, monitoring, and surveillance. The education institutions also have an important role to play in research, development, and training. Completely agree. There is not a specific question, but then I don't know if Ms. Debashree Mukherjee is still there. If she could give some highlight, give her thoughts there. Otherwise, Dr. Sarkar, would you give some thoughts here?
Yes. I fully agree with this observation that the Pollution Control Board can play a key role, because after all, they are the agency for pollution, controlling pollution in the state, in the subnational level. So their involvement in the wastewater monitoring will be very important for the purpose of early warning system. Yes. So I fully agree with the observation of the participants.
Yes, sir. Thank you, sir. Thank you so much. Going to the next question. This is also a comment, not a question per se. It is high time to provide Tier 2 and Tier 3 towns also with wastewater management by water treatment plant. Yes, this is question by Veera Prasad. Yes, absolutely. It is extremely essential, no doubt about it. How we go about it is a question, and how soon we get at it is extremely important. Thank you for those questions. The next question is, many village panchayats, especially their respective outskirts, do not have drainage system, which may lead further problems. Or basically, this question is related to the previous question, so I don't think we have anything else to add here. But then, having said that, rural areas have community wastewater streams from where we can collect samples and analyze. That will also give us a very good idea about the community health. Not just COVID, the one which we just saw, but also if a next wave has to come, this will be quite indicative. Dr. Paromita, would you like to answer something here?
Yeah, and also, you know, in the rural communities, like if there are areas where open defecation is prevalent or low sanitation areas, those needs a lot of attention and definitely such surveillance, which we have seen in the riverine belt. Like, you know, like it's not rural, it is within the city, but there can be low sanitation belts, which we need to monitor for sure. Yes.
Thank you, Paromita, for that. With that, we conclude the technical session. May I now invite Dr. Jonathan Demenge, Head of Cooperation for Swiss Agency for Development and Cooperation in India, for the keynote address. Briefly about Dr. Demenge, he lives with his family in Delhi. He was previously country director of the International NGO Generous in Tajikistan, working on energy efficiency in housing and agriculture. Trained as an anthropologist, He holds a PhD from Institute of Development Studies in Political Ecology on road construction in Ladakh. Has calculated the first ecological footprint of subsistence farmers in Ladakh. He has worked for the Netherlands Development Organization, the Overseas Development Institute, various NGOs, and as a researcher in Nepal, India, Tajikistan, Ethiopia, and West Africa. Dr. Damange, the floor is yours. Thank you for coming.
Thank you very much, Girija. Respected Additional Secretary, Mrs. Mukherjee, dear Dr. Sarkar, Dr. Bharat, dear professors, dear panelists, and dear public. It's a renewed honor to be with you for this World Sustainable Development Summit. And sorry for coming late and missing the beginning. I was attending another session. And after a first fascinating session on air pollution, I'm now ready to dive deep into this session on monitoring of community wastewater for early signaling the spread of COVID-19 in Chennai, and to dive into the politics of wastewater. You have heard eminent specialists on the question, and now you have in front of you the least specialized person. Fortunately, I had the chance to follow the work of the team, to read their reports, a policy bulletin, now a policy brief, and to attend 2 other events organized by MUGAMA, the SRM Institute of Science and Technology, and TERI on the topic. So I will still try to give you some interesting elements and reflections. And if I fail, I will have at least given some time to the last speakers to deliver an even better conclusion. So please stay with us. I must say, in each of these 3 events, I've been impressed. On a scientific point of view, I've been impressed by the multidisciplinary approach and methods, building on hard scientific and social science, empirical and theoretical research in an extremely pragmatic way, achieving what we could call social political ecology. On a practical and policy point of view, I've been very impressed also by the numerous applications that come out of this research on wastewater-based epidemiology. Early signaling of COVID-19, even before symptoms are visible at very low cost, enabling to follow concentrations and therefore the spread of COVID-19 relatively quickly. Analyzing the impact of lockdowns and policies within communities and between communities. Who is impacted? But also who has access to proper sanitation? And on this, Dr. Verhagen added another socioeconomic dimension to access to water and sanitation, to protection from COVID risk, to access to healthcare. And I hope that the utility of such research in terms of public health will also be recognized, because I think the potential is immense. I must say I've also been impressed by the interest and the amount of visibility this study has generated in the scientific community and beyond. During the last event, we had the participation of senior members of NITI Aayog and Chennai Metropolitan Water Supply and Sewerage Board. And this time, we are blessed with the participation of the Additional Secretary of Jal Shakti, Mrs. Mukherjee. And I think this also shows the interest and potential use of this research. The COVID-19 pandemic has put humanity in a deep crisis. It has been tragic and terrible in many ways. But beyond the human, economic, and social tragedy that is unfolding, the COVID-19 crisis has also brought some opportunities. It has speeded up the digitalization process by 10 years. And this virtual event is just an illustration of this. In fact, even the most carbon-intensive events, the one that used to attract hundreds of private jets from around the world, not to name it, have been forced to go virtual and to go carbon neutral. And we've discovered that we could act on greenhouse gas emissions, that the reductions in emissions are not durable, and that we have so far failed to initiate the green recovery that the climate crisis requires is another issue. But that is not over. And I very much connect to the message sent by Dr. Verhagen as well on this, on the need, on this triple dividend, and on the need to build back better and greener. Finally, in direct response to the pandemic, we've also increased cooperation in public health, developed vaccines in a record time, and developed, improved, and brought COVID or RNA tracking methods to other parts of the world. So if necessity is the mother of inventions, and this study is a good illustration of it, having talented scientists and communicators obviously does help a lot and is key to it. I have mentioned climate change, and others have before, because climate change is the other big existential threat, probably even bigger, that we are facing. And the main reason why the organization I represent, the Swiss Agency for Cooperation and Development, or SDC, is working in India. And together with the Indian government and the Swiss and Indian partners like TERI, the Swiss Agency for Cooperation and Development works to promote low carbon development, because we need to act globally to limit our greenhouse gas emissions, to contain the increase of temperatures as much as we can. And that is why we have projects on developing low carbon cement, on clean air, on energy efficiency in buildings, and on renewable energies in buildings and in agriculture. And SDC also works in India on climate resilient development, because climate change is a threat, is a big threat, is an emergency, and we need to make communities, cities, and states more resilient to the impact of climate change and natural hazards. For instance, we work on climate adaptation plans for cities and states, for instance, the states of Tamil Nadu and Gujarat. And we work with the Indian Himalayan states to monitor, understand, prevent, and manage disasters, like the floods and debris flows that have created havoc and have taken many lives in the Chamoli district of Uttarakhand earlier this week. And because addressing and adapting to climate change requires 1,000 solutions, it also requires a lot of cooperation with the government of India, with our Indian and Swiss partners, with multilateral and bilateral partners. And because climate change is accelerating, we also need to speed up the implementation of these 1,000 solutions. We need more commitments, and we need more action. Countries like India, Switzerland, members of the EU, can and must all be climate leaders. So we do not need to walk the talk simply. We all need to race it. So SDC focuses on climate change, but it cannot remain indifferent to the needs of the time and the plight of the people, which is why Switzerland has been supporting several COVID-related initiatives in India, in health, education, livelihoods recovery, as well as in COVID tracking and community wastewater. And this study also enables us to build a link between climate change and public health, since climate change will cause additional challenges for public health in many ways, be it the impact of heat waves, the spread of disease and zoonoses, and so on and so forth. So it also enables us to think of the wider link between the environment and public health, between pollution and public health, because in the end, human populations are just as healthy as the environment around us, which is also the reason why SDC has a global program on health and a global program on water. Yes, sorry. Who together, these two programs work on the issue of antimicrobial resistance that develop when antibiotics are released into water and into the environment. So for this very reason, in cooperation with the Stockholm International Water Institute, and together with manufacturers, buyers, and regulators in India, SDC works to set a responsible antibiotics manufacturing platform, or RAMP. So on these words, I would like to thank again UGAMA, the SRM Institute of Science and Technology, and TERI, our speakers, as well as the public, for taking part in this event. We are part of this World Sustainable Development Summit with a fundamental task, defining our common future. So let's keep the spirit up and take commitments and action even higher. Thank you very much.
Thank you so much, Dr. Debange. These were very, very reflective statements.
My pleasure.
Our next speaker is Ms. Sakshi Chandra Dasgupta. She's a senior thematic advisor with SDC. She's responsible for SDC's urban and environment portfolio. She has more than 15 years of experience in the urban development environment sector. She was earlier associated with DIZ, CSC, TERI. Sakshi holds a master's degree in urban and regional planning from CEPT, Ahmedabad, and is an alumna of Delhi School of Economics and Miranda House. May I request Sakshi to share her thoughts and summarize the session. Thank you.
Thank you. And sorry for this. This is really our worst nightmares. One of our worst nightmares. When you're about to speak, something wrong happens with the internet and the network. But I think there is very little left for me to say. A lot has been said, both on the technical by the eminent researchers, and importantly by Dr. Sarkar and Mr. Who was kind enough to join us for this event, and also very clearly elaborated on her vision about what she wants to do and what the government is grappling with on several fronts, be it the economy, be it on the health scale, be it and Jonathan, through his speech, also reiterated the fact that from our side, we have been supporting all sorts of COVID task and project that we could during this time. For me, I think personal thanks to Girija, Dr. Paromita, her entire team, Dr. Sarkar, Mary, and all the other researchers who were part of the study. We are very, very happy, and it took us a lot of effort during this COVID to do these surveys, do these lab tests at that very moment, come back with the results, and to ensure that the and relevant, and we don't miss out on the timeline. But now it's really, we would request the ministry, Niti Aayog, and all the relevant people involved at the policy level, at the government, to take this from a mere research from a technical study to one that transforms into action and has some policy relevance. With that, I would like to thank you, and we hope to continue the dialogue with the ministry and Niti Aayog hereafter. Thank you very much.
Thank you, Sakshi. Thanks for those kind words. Unfortunately, there was some issue with your audio, but we managed to understand what you had said. Yeah. So before I give a vote of thanks, we just are running very short of time. So I would just take just 1 or 2 minutes to give my vote of thanks. In fact, it's a privilege to propose a vote of thanks for this knowledgeable panel of experts, policymakers, national and international experts, and the distinguished participants. Ms. Debashree Mukherjee, many thanks for taking out time for sharing your thoughts. Much appreciate. Dr. Jonathan and Sakshi, our gratitude to the Swiss Agency for Development and Cooperation for supporting this study, and we much appreciate your cooperation throughout this project. Dr. Joop Verhagen, very thankful for sharing your valuable insights. Even though you have left India, we get back to you as always. Dr. Magdalena, so good to hear your exemplary work in this area, and good to know that we are in alignment in the protocol, the SOPs. Dr. Godatharaman, much appreciate your exemplary work, and thanks for accepting our invitation and sharing your thoughts. Thanks, Dr. Sarkar, for your guidance, perspective at each and every step, which has been instrumental in successful delivery of the study, as always. I would like to thank Dr. Sunil Pandey, Senior Fellow and Director, Environment and Waste Management Division, TERI, for reviewing and providing his expert inputs in the policy brief. Dr. Paromita, your enthusiasm is highly infectious, much more than COVID-19. It has been a great delight to work together in this project. Thanks to the very agile and passionate team, Dr. Sundar, Nihal Mohammed, Sarat, Maitri, Ronnie Rex. Pandemic, summer, monsoon, lockdown or no lockdown, the work continued. When the going got tough, the tough got going. Hats off to a great teamwork. It was very exciting research project for us. I would like to thank my colleagues, Ms. Mary Abraham, Ms. Avanti Roy, for your invaluable contribution to the project all stages. Thanks to Dr. Nagababu, Anagha, Mayuri for helping with rapporteuring and managing the Q&A session today. Sincere thanks to all the participants who were so patiently listening and attending today's event. I take this opportunity to profusely thank WSDS Secretariat for all the support you have rendered in making this event a success. Thanks.
Thank you. Thank you.
Thank you so much.
Thank you. Thank you, madam.